The vast majority of people who get this are going to recover. They're going to feel achy and fluey for a couple of days and want a low-grade fever, sore throat. They know they've got a viral infection. And then it passes. And so those may drag on for a week or two, but they get through it. And the good news is if it's like all the other viral infections, the person will then be immune. And so each person who gets it and gets through the other side, there's one less place for the virus to set up housekeeping. And this is how immunity spreads through the population and how epidemics go away. So the folks who get it and get through it are the basis for this whole thing fading away. This is a respiratory virus. It comes in, but it's not a classic pneumonia-causing virus where the bronchial tubes get all mucousy and thick and the person gets a classic pneumonia. This rides in through the bloodstream and the lymphatics, which is one reason they say don't touch your eyes or your mouth. What happens is that the virus does wind up in the lungs eventually. People cough into their hands, say, and then they grab a doorknob and transfer the virus to the doorknob, and someone comes a few minutes later, grabs the doorknob, gets it on their hands, and then rubs their eye. And the virus will get into the bloodstream, into lymphatic channels, ride through the bloodstream, and come in through the connective tissue of the lung, around the cartilage and the fibrous scaffolding that holds the lung shape. And it's not a classic inhaled pneumonia-type virus in that way. And so most folks, especially if you're young, your lungs get a little sore for a few days, but then you cough, but then it goes away. It hasn't really compromised your ability to breathe, etc. The problem is in about 20% of folks, as the connective tissue of the lung gets inflamed and swollen and edematous with fluid, it gets stiffer. And so it's just hard to mechanically move those lungs in and out because the scaffolding is stiffer. And so young people don't have a big problem with this, but if you are an old person, say, with congestive heart failure and your lungs are all full of blood and stiff anyway, this will certainly tip you over into trouble. The folks with emphysema and asthma who have stiff, damaged lungs, this can really put them in trouble. If you're diabetic and your blood's full of sugar, it's harder for your white blood cells to combat the germs, and so the diabetic folks can wind up with problems. The older folks, and especially the very, very frail ones, they're the ones as their lungs get stiffer are going to suffer the worst from this. So it's no joke, but you're right. The more people do die of influenza. This thing is so contagious and people can get so sick so fast that they wind up in the emergency room, they wind up in the intensive care unit, and it has the potential for thousands of people with these stiff, inflamed lungs piling up in the halls of the hospitals because there aren't enough ventilators and ICU beds for them. That's the real horror specter here. Now, but the individual infection itself, you're right, most people are going to get through it and it's not going to alter their lives terribly at all. It's going to alter our economy, as it certainly is. But as viruses go, we've seen worse ones and there will be worse ones, unfortunately.
What about smokers, both cigarettes and marijuana, young people who smoke?
Sure. Yeah, absolutely. The battle that gets waged in the connective tissue of the lung there, you need healthy lymphocytes, you need healthy mucus, you need healthy antibodies, and all that requires healthy lung tissues. And inhaling hot smoke of any kind, tobacco smoke, marijuana smoke, etc., well, it causes a burn. It causes a low-grade thermal burn, and now your body's busy trying to heal burnt lung tissue on the inner lining of the lung. It's not going to be very efficient in making antibodies against viruses. It's working full-time to repair this burn you keep inflicting. So, no, you're absolutely right. The smokers, including the cannabis smokers, wouldn't be surprised if theirs wind up in respiratory distress because they kind of set the stage for that with their inhaling of the hot smoke.
I was listening to a briefing from Cottage Hospital, which is in up in Santa Barbara. Mm-hmm. Right. And that doctor was saying, this is just kind of a side note because I was just really interested in this fact, and maybe this is true with all viruses. As an athlete, I knew a lot about and learned a lot about red blood cells and white blood cells, just a lot about blood work in general, maybe more than I really needed to know. They said that this virus, people are coming in and it's showing normal white blood cell counts at around, the normal, like around 4,000 or something. And I was just curious as to why this viruses or some viruses in general, why your white blood cell count stays the same. But with bacterial infections, it does change significantly. Like your white blood cells kind of go on high alert. What is the reason for that?
Yes, we unfortunately got to get into a little bit of technology here, but we have a number of different types of white blood cells as part of our immune system, and the white cells the white cells that are responsible for eating up bacteria, pneumococcus, the classic strep bacteria, etc. They're called neutrophils. They're made in the bone marrow, and they have to physically creep up on the bacteria and engulf it and inject peroxides and actually kill the bacteria, hand-to-hand combat, so to speak. And in the middle of that pitched battle, the bone marrow was churning out lots of these white blood cells, bring in the reinforcements, send in the cavalry, and classically white blood cells, the total count goes up 10,000, 12, 15,000 or higher during a rip-roaring lobar pneumonia. You get white counts of 20,000. But these are neutrophils that eat up bacteria. What's happening with viruses is it's fought on a whole different channel. Here, the neutrophils don't react much, but another type of white cell called lymphocytes, which are made in the bone marrow, but also in the lymph nodes, they don't attack the viruses directly. Viruses are way too small. What the lymphocytes do is they start churning out antibody proteins. They're like the anti-missile missiles that seek out the viruses and lock onto them, and they're taken out of the system by a number of other mechanisms. And you don't need whole lots of numbers of lymphocytes. Occasional, some viral infections do cause a lymphocytosis, mononucleosis, Epstein-Barr virus infections often cause an increased lymphocyte count, but often you don't. But if you look for it, what does go up, of course, is the antibody, the IgG level skyrockets. And there's the sign of the battle, not the number of lymphocytes, but the amount of antibody proteins they're putting out. That goes through the roof. And that's the sign of a viral battle going on. So it's the difference between the two types of white cells that respond to the two different types of infections, bacterial versus viral. Sorry if that was
well said, and the analogies were great. I understood it. So if I understand it, I know our very intelligent audience is going to get it.
Yeah,
so I was talking with my husband Ian yesterday, and I realized how little I know about Contagion, because you know how you have somebody who's come to visit you or at the dinner table, and they cough, and you say, and they say, oh, no, I'm not contagious anymore. I've had it for a week or whatever. How do you know when you're contagious? And what's the general rule of thumb for contagion for both this virus and I guess there's a difference, you've just elucidated it, between bacteria and viruses. How do we know when we're contagious and not contagious?
Right. I wish there was a little sign lit up on your forehead saying, I'm no longer contagious, I'm still contagious, because it's an archetypal ancient question. And our best answer really comes from the Chinese experience, who if we have this tsunami of coronavirus blow through their hospitals, et cetera, and they're faced with the same issue. And when do they stop culturing live viruses out of their patients? How long after they become asymptomatic, when the fever's gone, the cough is gone, the sore throat? Boy, they're talking a minimum of 3 weeks after symptoms are gone. And there's a suspicion that it may drag on for way longer than that. And so it's going to be a matter of, it's going to be repeated swabs until you have 2 negative swabs at least 24 hours apart. And then, as I said, anywhere between 3 weeks when the symptoms have gone, and I wouldn't be surprised if it's 6 or 8 or 10 weeks after that. And that's a real issue as far as letting it fade out of the population. It may circulate in a low-grade level from people who don't even know they're infected, or they think they're over it, and yet they still, when they cough or touch surfaces, there might be live viruses there. We've got ourselves in a bit of a pickle here, and it's going to take some creativity and perseverance on everybody's part to get through this. It's a matter of keeping yourself healthy. If you get the infection, you want to really let it just be a sore throat and a cough and a fever for a couple of days and feeling achy. And that means get your body in as good a shape as you can. And here's for that plant-based diet that you mentioned. You want a big fresh salad every day. Keep your immune system spruced up. Get enough sleep. Don't eat sugary junk as a food. That lowers your immunity.
There you go. I knew going to the chocolate aisle.
Put the chocolate away. I got to put the wine away too.
You can have a couple of squares, but don't eat sugars of big chunks of it for food. Right. Drink enough water. Have 5 or 6 good 16-ounce glasses of water during the day. Keep your secretions thin and keep yourself well hydrated. And talk about mushrooms, being able to boost your lymphocytes' ability to spruce their immune ability, as well as a sea vegetable, wakame, in the green seaweed in the Japanese restaurant salads. That seems to help as well. But basically, get enough sleep, drink enough water, and the less time you spend out in crowds, the better.
Hey, folks. Okay, back by very popular demand is our plant-powered plate fridge magnet, which you are going to receive for free if you leave us a rating and a review on whatever platform you're listening to this podcast on. So here are the details. Just write your quick review. Does not need to be long, does not need to be a whole story. Just be honest and speak from the heart. Then take a quick screenshot of the review you wrote and email it to us at podcast@switchforgood.org. That's podcast@switchforgood.org. And include your mailing address so we can send you a power plate. We are doing this because the more reviews we garner, the higher we go in search results, which means more folks will learn about our podcast. So the power is in your hands. Leave us a review and zoom, your power plate arrives at your doorstep.
So thank you so much for tuning in today. If we helped you in any way, then click the subscribe button and let's keep hanging out together. We have so much more to share with you.
And if you need more information on actually making the switch for good, please visit us at switchforgood.org for loads of info. And you can subscribe to our mailing list where you will receive all sorts of super cool gifts, discount codes to our very fave dairy-free products, and a lifetime of powerful health tips.
So join us on the journey to switch for good. This is the future.